When we're talking about safe sleep, it's also really important to acknowledge that there are many products on the market that don't conform to safe sleep guidelines. So as we put our baby down on a surface, it should be flat, it should be firm, and ideally with a waterproof mattress. So this applies to the cot mattress or the Moses basket mattress, or also applies to bed sharing on an adult mattress. When you're choosing products, ask yourself those questions. Is it flat? Is it firm? Has it got a waterproof cover? Does it comply to British safety standards? And there are many products out there that don't conform to those. Products that are soft and not flat and firm, particularly things like nests and pods, sleeping positioners. These are all potentially products that may increase the risk of sudden infant death syndrome because they don't fit that flat, firm criteria. So it's important as parents that we're aware of that. And if you were choosing to use these products, to understand that babies shouldn't be left unsupervised on these. When you have a new baby, the times when they're going to sleep are an ideal opportunity for you to get some rest as new parents as well. So you don't want your baby to be on a product that doesn't conform to these safe sleeping guidelines, because then the advice would be to observe your baby on there and to ensure that they don't overheat. So just think very carefully about these products, whether you choose to use them. Remember, they don't conform to the safe sleep guidelines. Many parents, as you sat watching this, preparing for the arrival of your little one, might have made a decision whether you intend to bed share or you don't intend to bed share. Many parents might say that actually they feel that their baby is safest in their protected space of a cot or a Moses basket or a next to you cot next to the side of the parent's bed for the first 6 months, and that they feel the baby is safer in there. But the reality is that as we become new parents, perhaps what we intended to do and what we actually do are very different. And I was certainly one of these parents that my preference was to perhaps not bed share, but that with breastfeeding a baby, we did end up bed sharing. And that was a means of my baby being more settled and me also being able to get some rest as well. You will get some information on safe bed sharing before you go home to remind you of all these principles. If you're going to bed share, the way to do it safely does not increase the risk of sudden infant death syndrome. In fact, there's some evidence that says that perhaps bed sharing may help reduce the risk of sudden infant death syndrome if it's done safely. So we bed share, we never risk falling asleep on a couch or in a chair or on a soft surface. And the reason for this is that as a parent, we relax into a sofa or an armchair. It's not that flat, firm surface, and it's very easy for our grip on baby to perhaps loosen, and then the baby becomes perhaps trapped between mum or partner and a sofa cushion because it's not flat and firm. So as new parents, you're going to be tired. If you think there's any risk you're going to fall asleep with baby, it's much safer to do that in a controlled environment on your bed. We don't recommend to bed share if either parent smokes. We also don't recommend bed sharing if your baby was born prematurely or was low in birth weight, so less than 2.5 kilos. Speak to your midwife or health visitor for more specific advice for if those apply to your baby. We don't recommend bed sharing if either parent is drinking alcohol or under the influence of any drugs, prescription or non-prescription, that may impair your awareness. So it's really important to think about even something as simple as an antihistamine that might cause drowsiness, or a cough mixture and nighttime formulation that's designed to help you sleep. Those potentially impair your consciousness, your awareness level, and it wouldn't be safe to bed share on those nights. The safest way to bed share is that actually, if you're in a double or king size, that as parents you move your bedding, your pillows and your duvet to one side of the bed, and you have the other side of the bed protected for baby. It's really difficult to bed share safely if you have your baby in the middle and you have a double quilt or a duvet, because your baby's then potentially going to be encased in that. So your bedding needs moving out of the way. And then your baby is using a sleeping bag or sheets and blankets that are tucked either side and underneath as well, so that your baby can't slip any further down under that bedding. It's important that your baby is positioned so they're not potentially going to be right on the edge of the bed or in a position where they may get trapped between the wall and the mattress. Bed sharing is safe if you follow this safe guidance. So you will be revisiting this after your baby's born.